I feel like women's hormones have been neglected. We have done weight loss with women for a few years now, and I think that is a crucial component to overall women's health, but we've been neglecting the hormone optimization part of it, which only fuels weight loss, how you feel. So I think combining these will only provide a better service for women overall. We helped a lot with weight loss and everything, and that's a great component to women's health. But I was frequently telling women, I think you would feel better and have even better weight loss with hormone optimization. And I was sending them away to seek that, and they're having difficulty finding someone to manage that for them. They kept kind of pushing, the PCPs, OBGYNs, and they were just told they're normal and to continue on with weight loss and what they're doing. And I understand where the PCPs and the OBGYNs and everything are coming from, because a lot of it stems from a study from the Women's Health Initiative 20 years ago. This study showed that hormone replacement caused a 26% increase in breast cancer. And this was a $1 billion study, so it was not just a little study. And this became gold standard. And since then, prescriptions have dropped off to almost nothing. While this was a good, study, expensive study and everything, I think a lot of the fears are overblown. The biggest takeaways that people get is it showed that a 26% increase in breast cancer. This was specifically a combination of conjugated equine estrogen and medroxyprogesterone acetate. That specific combo did have an increase in breast cancer. This is a 26% relative increased risk. When statistics are used, if this is translated to an absolute risk, this means that an increase of 2 per 1,000 women at baseline increased to 4 of 1,000 women at baseline. This is comparable to the same amount of cancer increase as drinking alcohol at night. Just a diagnosis of obesity is about this same increased risk in breast cancer. And this risk is not translated if medroxyprogesterone is dropped. We do not see this with micronized progesterone. Female hormone replacement is tough because medroxyprogesterone is a synthetic progestin, and micronized progesterone is bioidentical and better utilized by the body and may even be breast protective, showing that there's a decrease in breast cancer. Even in the WHI, estrogen alone showed a decrease in cancer. And this is with conjugated equine estrogen. I do think that overall bioidentical estradiol is much safer and has a better safety profile and outcomes in terms of bone health, heart protection, that kind of stuff. But we do have this giant study to show that estrogen is safe. And even in the combination of the conjugated equine estrogen and progesterone group, there was no increase in mortality in breast cancer. Even though there was a bit of an increase, there was no increase in mortality, and the people who had hormones actually did better. And there's been tons of studies since then trying to undo this. Dr. Blooming has a book called Estrogen Matters, where he goes through 25 meta-analysis, and 24 of them showed either no difference in breast cancer or even protection, aside from one, which is the Habit study, and that does show an increase, but it's flawed in the sense that these women did not get, even though they had a history of breast cancer, they did not get mammograms prior to being enrolled in the study. There was no regulation in the placebo or which progestin was used or progesterone. And it was only a 2-year follow-up. So it had some flaws, but there is a study to show that it increased later. But just from those 2 studies, millions of women have been denied hormone replacement, and with hormone replacement denial comes worsened genital urinary outcomes, so sexual outcomes, reduced bone protection, reduced cardiovascular protection. Hormone optimization improves weight loss, improves energy, improves just overall general well-being. And so overall, I felt that it was needed to bring into the practice to provide all-encompassing care of this woman instead of just focusing on weight loss alone. We do a great job with weight loss, encouraging resistance training, high protein intake, utilizing medications when needed, but that needs to be coupled with hormone optimization if they need it.